My name is Manny Turan, and I'm CEO of SaiOx. We are commercializing a technology from the University of Arizona to address a host of respiratory diseases. Our device is occupying a space between traditional non-invasive ventilation and full-blown mechanical ventilation. That space is forever changed due to coronavirus. What we're addressing now is a new paradigm in treatment options that have taken center stage as we're dealing with this virus and as we're dealing with an ongoing change in the way that healthcare is delivered.
I'm Sai Parthasarathi. I'm a professor of medicine at the College of Medicine, Tucson, and an inventor of the Hespiro device. What I wanted to talk to you about is the three principles of the Hespiro device. The first is that it uses a HelioX gas mixture. Secondly, it's a low pressure system as opposed to high pressure systems that are conventionally used. And the third aspect is that it uses a rebreathing system that scrubs the air of carbon dioxide that's exhaled so as to prevent the carbon dioxide count from becoming elevated. The three of these combined together, for example, the low pressure system along with the HelioX system, allows for comfortable breathing. The HelioX, combined with the rebreathing circuit, not only conserves the gas, but along with the low pressure system, it contains the coronavirus infection to within the system and the patient so that it doesn't spread into the room.
Our go-to-market plan starts with the FDA's recent ruling of an emergency use authorization plan, which allows us to take this technology to market quickly. The traditional FDA path can take 6, 9, 12 months or more, and we're going to be able to do this in the next couple of months to provide treatment to those that have COVID today, but on a longer term address the COPD and other indications we're dealing with. We're working with manufacturing partners here locally in Arizona as well as other domestic sites to provide this treatment device and help people immediately. We are seeking funds from both local investors, investment groups, family offices, as well as grant opportunities with the U.S. government and other government agencies to be able to put together a financial plan and deploy our technology to market.
There's every indication that the pandemic with the COVID situation is going to return. This is coming from authoritarian sources such as Anthony Fauci in the National Institute of Allergy and Infectious Diseases, who says that this may be an 18-month stint to the recurrence of the COVID pandemic in fall of 2020 and early winter of 2021. We need to be prepared for a return of this pandemic as well and have the capacity, not just with invasive ventilators, but also with non-invasive solutions that protects the frontline healthcare worker and the first responder from the potential of infection, but at the same time alleviating the work of breathing and providing respiratory assistance to patients who are in respiratory distress. Besides that, even after the COVID pandemic is behind us, there are over 16 million patients with either diagnosed or undiagnosed COPD, and the number of deaths due to COPD is in the top 5 in the nation of diseases that causes deaths, and we need to be able to tackle that situation. We believe that the Hespiro device will not only be an immediate solution to the COVID nightmare, but also a future therapeutic option for patients with COPD, as well as other respiratory disorders.